Hello and welcome to another episode of the Danielle K White Show, the beauty series, the beauty edition. I decided to do this beauty series because I actually get so many people who are like, what are your thoughts on this and this and this? I'm like, I am not a professional, so I should probably seek professional advice. So today on the podcast, we have Lindsey Harders. Welcome.
Thank you.
So we're gonna just go right into the tea, right out of the gate. Right before she came here, we were like, okay, who's done what's going on? We're going to start with that because it's kind of juicy. And then we're going to go into your backstory of why you do what you do and why you are an expert in your field. But first, ladies, she is a professional injector. And we were having a debate on this show. What has Kris Jenner done?
It's the $1 million question. We all want to know what Kris Jenner did. She looks phenomenal. But if I had to guess, I think it was a multimodal approach.
Right.
I think she has a surgeon on board. She had some surgeries done. I think she has a dermatologist on board and probably had some lasers, chemical peels, a really great at-home routine. I think she has an injector on board.
Yeah.
You know?
On board. Yeah.
Oh, yeah. She's got the whole team. She's got the works done. And I think it was done over time.
What do you mean over time? Do you think of a year thing, a 3-4 month thing?
I think a good 4 to 6 months is enough time to get an amazing result. To heal from surgery, to get the good results from the lasers and the microneedling.
Right.
She's got to have some volume restoration too, right? As we age, those fat pads start to go down. You lose the collagen and elastin in your skin.
Right.
So we've got to work on that gradually over time. It's not a sprint.
Hey you guys, it's Danielle K White. Welcome to the Danielle K White Show. On this podcast, what you can expect is anything from fashion, fitness, hair, and yes, even family. I'm the creator of Natural Vita Real Hair Extensions and Isla Hand-Tied Hair. But what I'm really passionate about is sharing other people's stories, how they went from the pit to the peak, how entrepreneurs build the success that you see online today. So definitely tune into this podcast for a good story and a little bit of fashion and a little bit of hair and beauty mixed in.
I wonder, so you see such dramatic results like that, and I know everyone's been talking about her too, is Lindsay Lohan, Christina Aguilera, all these celebrities where it's to me it's dramatically different, but it looks really good.
I think those are two phenomenal examples of celebrities who have just done it right. Anne Hathaway is another one. I think Anne Hathaway is absolutely gorgeous, and somehow she looks way better now than she did in The Princess Diaries.
Right?
They just have good people they're working with. There's a way to get bad work done, and then there's a way to get good work done.
Right.
So it should be so good that no one knows. And that's what we're all doing. We're all speculating,
I think
right?
everything with injectables, facelifts, it's getting better. It's no longer like the botch jobs that you used to see, 15, 20 years ago. It's literally everybody is reverse aging, but in a good way most of the time.
most of the time.
That's crazy. Okay, so let's get into your story. How long have you been in this field?
So I've been injecting for about 8 years now. I went right out of school into a residency program. I just fell in love with it during my rotations.
Oh, wow.
I was in cosmetic dermatology offices and was like, you mean that I can marry medicine and beauty and create confidence, extra confidence in these people. That's an incredible job. So I jumped right into it, and I've been working full time ever since, just with everyone, men, women, just in the beauty industry, just helping them to glow.
Well, it's funny because people might think of it as being vain, but same thing I feel with hair extensions. I'm like, you knock it till you try it, and then you do a transformation on somebody, and it's almost like their inner beauty comes out. Right?
Exactly.
It's they are they look in the mirror and they're like, wow, and they feel confident. And I don't think there's anything wrong with it. Now it's less taboo, but I feel forever people will be like, oh, she's had this done and this done and this done, and I'm
she drank the Kool-Aid.
Right? And I kind of look at it, one of my friends said, doing maintenance is like going to the gym, it's ongoing. You don't just get one syringe done and you're good for life kind of thing.
No, it's an ongoing process, and slow and steady really does win the race. We don't want to start with doing all of this when we're 20 years old. That's too young. But we can start caring about our skin at that time and trying to maintain our collagen levels the best we can.
Right.
And then eventually we get to a point where we're like, a little tox goes a long way just to prevent some of these wrinkles. Back in the day, 20, 25 years ago, it was, I see a wrinkle, now I've got to go get Botox.
Yeah.
But now we know better. Now we know that it's a way easier to prevent than it is to correct.
Right.
And we've got options on the market. There's a bunch of good medications now, some different than others.
Did you dabble in injectables before you started down this path in your career?
No.
Oh, really?
No, I was 24.
I was going to say, you look pretty young, so.
I was pretty young. I got microneedling done and facials, but I had never had it done. The first time I was injected was actually at a training where I was learning and the injector didn't have a model. Oh. And me, the brave soul that I was, sure. allowed her to inject me. Oh, wow. She actually did a good job, thankfully. Yeah. Now I know better, though.
Yeah. I've had one bad experience with Botox, and it was I went to a place where I was actually getting like a different procedure for like skin tightening. Okay. And I just was like, yeah, you know, I'm going to Europe next week. And I'm like, I have this little thing. I need a little touch up of my Botox. And she's like, oh, we have someone here. I'm like, oh, do they have time today? And she comes in and I'm like, hey, like, you know, she's like, yeah, we can freeze your forehead. And then I was like, she's like, what do you think about a little Botox right here? And I was like, what does that do? I don't even know why, but I agreed to it. My whole mouth dropped. And I couldn't smile. I still to this day feel like it's like a little bit off, like it hit a nerve or something. But like literally, I was like talking like this for like 6 months. And when I go to smile, I'd be like,
oh, that's so uncomfortable.
It was so bad.
And then you look back in those pictures and you're like,
it was so bad. Well, I did all these pictures in Italy, family pictures, and I looked pissed the whole time because I wasn't really, but I was just like, couldn't smile. Yeah. It was so sad.
Sometimes it's just better not to smile at that point.
What should clients look for? I mean, like I said, like I'm probably the worst because I'm very trusting and I go in, I just assume everybody's an expert. Now I've learned from situations like that you do your research and it's a customized approach.
Yes.
So for me, like when I go in, I'm like, okay, I know I want Botox. I don't even think I use Botox. I don't even know the product I use. I want a frozen forehead. That's what I know.
Exactly.
And so I don't know even like what to ask for because even as we age, I'm 42 and I do know but that's the thing. I always got to keep up on it, right?
Don't we all?
So I feel like as I age, I'm like, okay, well, why? I want this.
If I had a dime for every time someone did this in my chair, I'd be rich.
But everybody just, because as you get older, you just want to be a little bit
just
tighter.
Lift me a little bit more.
So when you look at somebody, is it a customized approach? Do you kind of like just assess their face? Like even for me, I'm like, I don't know what I need. And I would even ask, what do you think I need? Go look at my face. Tell me what
oh gosh, that's a trap.
No, it's not a trap.
No, you look good. Listen, I think we all have to keep up with our talks. I think we all have to maintain our skincare. I will never understand the people who get injectables and don't care about their skin.
Yeah. Because it goes together.
Yeah, you've got to fix the outside and the inside. You've got to address both. So when I give advice for people looking for an injector, I always say you've got to make sure, number one, that they're licensed because that's a thing still nowadays.
Really?
I know. Isn't
you can
that
like
a
go to
bummer?
Botox parties still and that kind of thing?
Yes.
And just anybody can get it?
Yes.
Like black market?
There's black market stuff out there. So you have to be careful. And you should always look at their work because there are tons of good injectors out there, but everyone's got their style, right?
Right.
So there's the people who like the more overdone look.
Yeah.
And for me, that might not be my taste, but maybe that's another injector's taste, and maybe that's what the patient's looking for.
Right.
I've had people come sit in my chair, and they're like, I want 2 syringes in my lips today. I want them big. And I'm like...
It's a lot.
I don't think we're going to be a good fit.
Yeah, do you say no?
Yeah, I'm really good at saying no. And sometimes my clients love that about me, and sometimes they don't.
Right.
But I know like what I think is pretty, you know, and I think
you don't want your name on that. If it's not something you like.
Walking billboards.
Yeah.
So I like a really natural look. That's what I like to be known for. So I do attract mostly that clientele, thankfully. But I think you should always look at the injector's portfolio, whether that's on Instagram or in office, to make sure that you align with their work.
Right.
And then obviously make sure they have experience. I think that's important too.
Right. And just make sure, like you said, that's so crazy because I've always like wondered, I'm like, I'll see like the lips that are like overdone. And I'm like asking my husband, I'm like, am I there? Is that me? And he's like, no, babe, you're good. I'm like, tell me if I get there. Tell me if I get there.
Great.
You know, it's crazy
but
though.
We do lose our ability to see that a little bit over time. We adjust and then we can't see it. So I have clients come back and they're like, I think it's gone. And I'm like, oh no, I can show you what you started with. Like there's nothing gone about your lips. But we do it's sensory adaptation.
It's true though. It was not too long ago. It was like maybe a year and a half ago. I was like watching some videos of me and I was like, my lips are like giant. Like I think I've gone too far. And I don't think I saw it. I was getting filler. Like you shouldn't have to get filler in your lips. Like I was getting it like every 6 months to a year. Yeah. Like you shouldn't have to do that. No. So I had to go and actually get rid of a lot of it. A lot of it had even like migrated. And it almost like made my lip kind of go out kind of strange. Yeah. And I didn't see it. And nobody told me that I needed to kind of start over. And nobody showed me it had even moved. And I was so worried, well, if I deflate them, it's going to look all weird and this and that. And we kind of just did it in steps and then rebuilt it a little bit. But I mean, I wouldn't have known. I would have been walking around with duck lips and not even known because...
A good injector will tell you to, like, hey, we need to stop, or hey, it's time to start fresh.
Right.
It can happen over time, but it can also happen for other variables too. Like, there's only so much room in the lips.
Yeah.
There's only so much they can hold. So if you overdo it, it's going to push up more.
Right.
There are certain products that can lean more towards that too. So you want to always use something in the lips that's very silky, that is highly movable.
Right.
Because
what's your favorite product in the lips?
RHA2.
See, there's so many new fancy names for things. I
So
just can't keep up.
There's over 20 fillers on the U.S.
Really?
market. And in the European market, Asian markets, forget about it.
Wow.
And there's 6 toxins in the market now too.
And
there's a lot.
How does it work? Like, do they come to you and they're like, this is the benefits of our products? Or how do you choose which products to use and why?
I really like to research the products, and a lot of these products have a ton of research backing them. So you kind of just pick the products that align with you, and then you play.
Yeah.
Over the years, that's why I say you have to go to someone experienced,
Right.
because you have to know when to put something in someone's face. So I always look at my clients. It's a very custom approach.
Yeah.
You don't want that cookie cutter approach. I want to look at their face and see what their skin is like, what I think it can hold, what they can actually benefit from, and then how much.
And I'm sure age plays a variance too.
Yeah.
You know?
If you've got the person, my little Florida girlies that, bake out in the sun and they've got that thinner skin and they're 60, 70 years old, you can't put something robust in their cheeks. It's going to look a little wild. So you have to really be able to tailor what you're doing to their face to know how to get a really natural, seamless result. Because at the end of the day, you don't want someone coming up to you and being like, oh, you got filler.
Yeah.
Like, you want
hey, your filler looks great. You're like, what?
You're like, no, you're not supposed to know. So you want to have them ask, like, oh, did you sleep well last night? Did you get your hair done? Something's different, but I don't know what.
Yeah.
That's what you want. And that's what we're doing with all these celebrities.
Right. So, okay, I had something recently put like in my jawline, but I don't know what it is, but it's supposed to stimulate collagen.
Sounds like Sculptra.
Sculptra. I was like,
Okay.
you're going to say it. And what are your thoughts on Sculptra?
Sculptra is great. It is a collagen stimulator. So it's not a filler.
Okay.
But it stimulates your body's own ability to make its own collagen. So it's great for thickening your skin, giving you that little boost. It can help with some hollows. It's a beautiful product, but it is used very differently from filler. I'm sure you got like the 5-5-5 rule. Like, you got to massage 5 times a day for 5 days, that whole thing. You would never do that for filler.
Yeah.
But, it's just a different product, but that's why there's just so many options.
I don't understand how that works. It actually does build collagen.
So your body has fibroblasts, and fibroblasts create collagen. So it's stimulating those fibroblasts to create more collagen. It's just like a little boost in the areas where it's placed. But the reason why you're massaging so much is because you don't want to get nodules from overproduction of collagen, and you want it to be very seamless and integrating throughout that area, not in clumps.
I was only told I needed to do it for like a few weeks, I think.
5 times a day for 5 minutes each time for 5 days.
Okay,
like
that's
the
what it was. I'm
standard
like, I
golden
don't
rule.
remember. I just remember.
You're like, oh my God, do I need to massage?
Yeah, I was like, oh no. Well, it's funny because I didn't notice a huge difference, but then it almost like, I think it just started to kick in. And it's still not that big of a difference, but my daughter was like, Mom, she goes, your face looks snatch.
Yeah.
So I'm like, cool, I'll take it.
Oh yeah, you put it strategically back here, and it's gorgeous.
Yeah, it just kind of gives you a little lift.
It takes time. Filler, you see right away.
Right.
You also see the swelling and bruising right away,
Right.
but you see it. Sculptra, you're really looking at 3 months before you're seeing
wow.
like full results.
Okay.
And even then, it's usually a few sessions. So patience is key with Sculptra. It's a part of that marathon, not the sprint.
Do you have to redo the Sculptra every so often, or?
Just as you see necessary. I mean, it's good to like get a little boost every year,
Right.
but you might not need to complete the entire treatment again.
Oh, okay.
It really depends on how you're holding it and anything else you do. Because if you're doing microneedling, that's another way of stimulating collagen.
So if I came to you and I was like, I want to be more snatch, would you do Sculptra again, or would you try something else?
It really depends on the person. Like for you, you've got gorgeous contour to your cheeks and your jaw and your chin. You wouldn't need filler. So Sculptra might be a good way to just benefit you, just to give you that
A little snatch?
Exactly.
And it doesn't migrate, right?
There's no migration with that product because
Okay.
it's not a filler.
Right.
Filler, you can almost think of like a little bit of an implant. Like your body will metabolize it over time.
Right.
The Sculptra, what happens is it comes as a powder.
Oh, okay.
That's what no one realizes. And you put water in it to mix it so that it can be injected. So then,
how did they know to do this over time? Or like, has this been a product on the market for a while?
For a long time. It was initially indicated for, or at least one of its main indications was for patients with AIDS. They get that cachectic face where it's really hollowed.
Oh, wow.
And it really helped to, make them look a little bit more youthful.
Yeah.
Again.
Isn't that crazy? You think about like Botox, people do it under their arms so that like if they had profuse sweating and things like that.
For
and
hyperhidrosis, it's amazing.
So we have all
TMJ,
these products.
Migraines. There's a lot of medical indications for that.
What's your favorite thing to do?
Ooh. I mean, my favorite treatment that I ever do is facial balancing because I'm looking at the face as a whole.
Yeah.
It's good to segment parts of the face like the lips and just do that, but it's really nice to look at it as a global assessment and see, okay, she could benefit from a little drop in the apex of her cheek compared to her mid cheek here compared to this temple, and you just dabble wherever you need in order to get a really seamless, complete looking result. That's where I see the benefit, and that's where every patient, I mean, they always love whatever treatment they get done, but they really call back like 2 weeks later and they're like, oh my gosh, what a difference. Yeah.
You're like, what did you do? Well, and that's the thing is I think it's important for anybody who's listening to this to understand you go to somebody who specializes in what you want. You want a very natural look. They're going to come reach out to you, do a consultation maybe, and kind of go from there. Yeah. What is so facial symmetry, like my friend who's in California, she's like, yeah, you look at it in thirds, this way and that way. Like,
yes. So you divide the face in half so you can look left to right, and then you do upper, middle, lower.
Okay.
That's how we typically, our brain works, especially when we're first learning how to compare for symmetry. What's funny about symmetry, and it's one of the 4 concepts of beauty, there's these 4 concepts that, no matter what color your skin is, what country you're from, you've got 4 concepts that work for every single person. Symmetry, averageness, sexual dimorphism, and youthfulness. Those are the 4. You actually don't want to be perfectly symmetrical.
Yeah, I've heard that too.
Yeah, because if you do like those, that TikTok filter that like split your face in half and then like flips one on the other side, or like they did that to Brad Pitt, Angelina Jolie.
Yeah.
You don't look as attractive.
Yeah.
So everyone chases symmetry. I want to be perfectly symmetrical, but you really don't. There's beauty in little asymmetries. You don't want to be completely off, and that's where that averageness steps in too. But you want a little asymmetry.
Yeah.
It sounds odd to say.
Well, like I said, like my friend who did my filler in my chin, I was like, I'm like, why do I need a bigger chin? She's like, trust me. And she did it. And I was like, oh, I do. I like it. It kind of balanced out my forehead, forehead and face ratio. Exactly. It was like I had a really small chin and like a little wider forehead. So when we gave me more chin, I was like, and it looks still like me. That's what I liked about it. You know what I mean?
Which is perfect.
Yeah.
And a good injector will be able to tell you that, right? Like, that's not your job as the client to say, I need chin filler.
Yeah. I don't know.
Some people will know, but some people don't. But
I was almost offended.
You're just like, something's off. You're like, what do you mean I need chin filler? It's perfect.
Yeah. Well, I was like, I want a little chin. And then she talked to me about like, here's what I'm seeing. I think it'll just balance you out. And I was like, okay, that makes sense. Yeah. So do you do skincare too?
I don't perform the skincare treatments, but I refer to my estheticians in office. Okay. I am a little bit of a nut when it comes to skincare. I really dig into it.
What are your favorites?
I am obsessed with Epicutis right now.
What is that?
It's a skincare line. It's got a lot of research behind it. They've only got a few products. It's more of a boutique-y line in my opinion, but it's indicated you can use it when you're pregnant. You can use it if you're having cancer treatments. It's safe. It's a clean line, but it is great for anti-aging too.
What does your skin routine look like? I feel like I have so many I open my drawer and I'm like, I feel like I have so many products and I get to this point where I'm almost overwhelmed and I don't know how to layer them or what to go where. And so I'm like, okay, firming serum. Okay. Vitamin C. Okay. We got this one. And I'm like, I just don't know. Like, what does your routine look like?
There's strategies based on molecule size and pH level. You've really got to defer to an esthetician when it comes to like, especially when you're doing different product lines. So if you're on like Zeo and Epicutis and Elastin, you're going to have to defer to someone who knows all those lines to be able to stack it for you appropriately. So I'm mainly Epicutis. I have a few Zeo products and I think that's about it. Maybe an IS Clinical product now that I'm pregnant, but cleanser, toner.
Okay.
I love a good eye serum.
Okay. What's your favorite?
Growth Factor Eye.
Oh, I have that one.
It's good. I can't get off of it.
Really?
It's the only Zeo product I still use. But I swear by it.
I do like it because I feel like if I don't use it, I'll be like, oh, I'm getting like the fine lines. And if I use it consistently, I feel like it's like I look more hydrated.
It really does hydrate underneath the eyes. And that silver tip is so good for anti-inflammatory.
It's so easy to put on. That's funny. That's like the only, I use Zeo and I use a couple other products too, but I do love that one.
Yeah,
it's
that's
good.
a great one. Lipid serum, if you haven't tried it by Epicurious, is
what does
incredible.
That do? Just hydrate?
It's a great barrier repair and hydrates.
Okay.
It'll also amplify whatever product you put underneath it.
Okay.
So you have to be careful how you stack it.
Yeah, there's like so many different products.
So many different ones.
So
I do miss a good retinol though. I hope you're on a good
Oh,
one.
I do. I have a retinol, but I only use it like every other day.
You only use it as much as your skin can tolerate.
Yeah,
you hope to
I'll
build up to every night, but if you can't, don't worry about it.
I'll start to get a little like pink. I'm like, okay, I'm good. My problem is I was a sun worshiper when I was young. I was in the age of tanning beds, and I was a lifeguard in high school. So I felt like I didn't start doing my skincare till probably like my later 20s. But I've noticed a huge difference. I used to have a lot more like freckles and fine lines. And I feel like just using good products has changed my skin. Now my big problem area is like my chest. Like I feel like I've been told I almost need to treat them like differently.
So you can use a lot of the same products on your face that you do on your neck and décolleté.
Okay.
So you can kind of just extend it.
Yeah.
Think of it that way. Like it's still your face. The skin is a little different, so you might want to be a little bit more delicate, especially with your retinols.
Right.
But you can always talk to your esthetician about that too. But you should, like, if you get a laser done on your face, get it on your neck and décolleté too, because you want them to all match. There's nothing that drives me more crazy than I'm watching like a reality TV show, for example, like Real Housewives, and they're on their interviews, and you see their face looks so good, and I'm like, you did not pay attention here to here.
That's kind of how I feel like mine maybe not that bad, but like
no, your neck looks fine, but
like I know you
know
need,
what I'm talking
when
about.
Their face is so tight, and you're like, dude, the neck needs some tightness and things too.
Yeah, or like I couldn't tell your age from here.
Yeah.
But here shows exactly how old you are.
I was going to say chest or hands. Is
hands
like,
too.
I know. It's
like it should all match.
Do you do injectables on hands? Can you? Right?
Yeah. You can put filler in your hands.
Really?
Yeah, it just helps to smooth out like any of the little boniness.
Have you ever done
that
it on your
see.
hands?
No.
Yeah.
I'm only 30.
Yeah, you don't need it.
Yeah.
I don't know. I feel like I'm kind of like I want to try it. Like I'm pretty lean, and I'm like I could use a little bit.
Little.
But I'm like one of those things like where it's like their hands. Do I really
like? Do I really care that much?
Like, do I really care that much?
Eventually, they'll probably bother you, but I just always say wait until they do.
So let's go Miami. Like, what is with the asses around here? Because I'm new here. I'm from California, and I'm like. I literally
like, I'm not used to this.
I'm not used to this. We were joking around how like in California everybody starts to look the same, and you're like, is everyone going to the same doctor? I feel like that's what I'm experiencing with the
butts here. The booties are all
like,
BBLs.
I'm like, is it a BBL? Is it a filler? I'm like, what is going on?
It's different.
Okay.
So some people it's natural, I'm sure. Genetics. They're a little bit more blessed than others. Some people it's working out, but some people it is implants.
Okay.
BBL. You can do filler or a Sculptra, like we were saying. Radius. You can do these things to help sculpt a booty or for hip dips.
One of my friends went and just recently, I don't know where she was, here in Miami, but she's like, yeah, I got some filler done. It wasn't Sculptra, it was something else. I was like, wow, that must have been a lot of filler. Like I'm imagining like 10, 20 grand of filler.
It's a lot of money. And because think of the surface area of like your chin to your booty.
I was like, I paid like
a lot.
$2,000 for this. I can't imagine like.
It's an expensive treatment.
Yeah.
And longevity wise, everyone will give you a different quote. For me, like I always say, go to someone who specializes in that. I am a face specialist.
Right.
That's what I love.
Right.
That's what I'm good at. That's what I'm known for. Go to a booty specialist.
Yeah, they'll tell you what you need.
Miami's got them.
Yeah, you're like I'm not that person for you.
No, I'm not afraid to say that either. Yeah. I've done them before, but I'm not passionate about it.
Well, it's like with hair. People ask if I do like crazy colors. I'm like, no, I do natural colors. That's what I prefer to do. I'm like, I could try to do it, but I won't probably do as good as a job as somebody who specializes in that. You know,
which some of those people. Wild what they can do.
Yeah.
It's incredible. Yeah. But I get what you're saying.
I'll get lost on Instagram and I'm like,
it's like a rainbow.
Yeah. So tell me, you are now educating and you have some of your own programs and courses. How did that, like, how far into your craft were you to where you're like, you know what, I'm doing things a little bit different? And did you have people like wanting you to teach them? Like, how did this all come to fruition for you?
Yeah, it was a demand-based thing. So I started out just as a private trainer a few years into my career. And then I started training for some of the pharmaceutical companies too.
Okay.
And that's been so rewarding and fulfilling because as much as I love the confidence boost I get in my patients, patients.
Yeah.
I also love seeing injectors being able to like hone in on their craft.
Yeah.
So I always say we have this like little toolbox as injectors, and we just pull out the little tools we need. So if I can teach them new techniques or new ways to use a product, it's so rewarding. And I always love the calls I get a few months later, and they're like, hey, that Nike switch technique you taught me, that's phenomenal. Or I swear by this product that you told me to use. It's nice to give back. And it's a hard field to break into.
Do you educate for a specific company, or is it your own thing?
So I still do private trainings.
Okay.
I never let that go, but I do educate for Revance and for Prolinium.
Okay.
So, and it's been a lot of fun. I travel the country.
What's Revance and Prolinium? They're like...
Those are the companies themselves. So then Revance has Daxify and the RHA collection, and Prolinium has Versa.
Oh, okay.
So they're just different product lines.
Right.
But they're all, I mean, there's so many good options on the market. It's all about really who's filling you.
Right. Well, and that's the thing too. I feel like it's such an art.
It is.
Like everybody is a little bit different based off of how their face moves, how they age, their skin, like everything. And so I feel like now you have to keep up to date with your training. So it's good that you're a trainer for them because you probably get a ton of education, right?
Yeah. I really believe in like, you have to keep educating yourself. Like you're never going to be a master.
Right.
That drives me crazy when people are like, I'm good. I'm done on
everything's
learning.
always evolving.
This industry especially, it's boomed over the last few years, like we were talking about. It was taboo years ago. Now everyone's doing it, and the industry has seen this huge increase in demand. So there's always new techniques and new products, and we have to stay up to date on that for our clients.
Right.
So that's our responsibility. And so I love getting educated, and I love educating.
Yeah. Well, it's interesting because like my mom, she's a cute little gal. She's like in her 70s. I think she's done maybe filler and Botox once her whole life, but she's had several facelifts because back then, nobody maintained like they do now. And so it's interesting. It's okay, back then to go, you wait till you're in your 50s and you go get your first facelift, and then 60 and 70 or whatever it is. Yeah. And yet injectables were like frowned upon, but yet you could go get a full on facelift. So now I feel like it's not to say, I mean, I'm sure I get to the age where I don't mind a little bit of both, but I just think there's so much that you can do to keep people feeling youthful. What is passionate for you? Like, is it just seeing the transformation that your clients have that makes it kind of rewarding for you?
Yeah. They always say, I want to turn back the clock. I want to look like when I'm 20. And maybe that's not realistic depending on what they look like currently, but I love seeing the little confidence boost they get after just some simple in-office treatments. That can be done in 20 minutes, Not to say you won't be swollen and bruised potentially, but it's not necessarily the same downtime that you would have as if you got surgery. Right. So surgery is irreplaceable, right? We need it. But there's volume replacement that needs to happen too. And I think that's a common misconception with facelifts is, I get this facelift, I'm good to go.
But you don't have volume.
But if you still have lost, some of that fat pad in your mid cheek, or, you've just depleted a little bit, you're going to need some kind of volume, whether that's a fat transfer or a filler.
Okay, what is that? What would you do for a fat transfer? Would you do that in the face? Can you do that?
So that's something a surgeon does typically when you're already under doing the facelift. But now there's even products coming out that are fat stimulators, or you can inject the fat, but I'm still keeping on the filler train for now. I like it to be dissolvable.
Yeah, in
just
case it
God forbid
moves
someone
or
doesn't
something.
like it. Or it moves, something goes wrong. It's nice to know that I can exit the room that I'm in, if I need to.
I had friends, and I had a friend, she had cheek filler done, and it like completely moved and migrated. Is that common?
I wouldn't say it's common, but it's definitely a risk that people should be aware of going into it. And it can happen for so many different reasons, but it is something to be aware of. And that's why when someone says like, oh, I got this permanent filler done 20 years ago, can you fix it?
You're like,
I
no.
cringe. I'm like,
you're like, what's in there?
I'm like, number one, we should never be using permanent fillers. The face isn't permanent, right? We
moving.
age. We're moving all the time. We age decade to decade. We can't have something permanent to make us look good when we're 20 and expect it to look good when we're 60.
So it's like having a boob job and expecting you to look good 20, 30 years later.
Or like someone who gets a boob job and then gets pregnant 3 times. Like breastfeeds. Your boobs are going to look a little bit different. So just things change over time. So we need something that we can change. So I mean, I've got stories for days on that, but some people have put some crazy stuff in their face.
I want to hear a couple.
The craziest, one was someone, she wanted me to fix her lips. She was maybe 50s to 60s. Lips were not in great shape, I would say, to put it nicely. And I was like, I know
Just
that's not filler.
overfilled?
Yeah,
But, like,
but
with
lumpy,
weird-
bumpy.
Yeah.
You could tell something just wasn't right.
Yeah.
And I was like, you're sure? You've just had hyaluronic acid filler. Like, I can go in and dissolve, no problem.
Oh.
She's like, yes. She keeps going. She had told my assistant the same thing. My
Yeah.
assistant had really questioned her too, because
Yeah,
they're
yeah.
trained very
You're
well.
like, so many red flags are going off.
We know that something's
Yeah.
wrong. Sure enough, I'm getting ready to go pull the dissolvent out to go just electively dissolve her.
Yeah.
And she's like, you know, the craziest thing happened like 20, 30 years ago. Can you believe they were putting cadaver tissue in lips?
Oh, no, she said that?
And I was like,
Ew.
no, I have a hard time believing that. Is that what's in your lips? And she's like, oh, yeah, they were just like trying it on me one day. And I was like, oh, ma'am.
You're all taking the needle away.
It was so nice to meet you.
Yeah, did you turn her away?
Yeah.
Oh,
Unfortunately, I
geez.
couldn't help her at that point. I was like,
Yeah.
you might want to go consult a plastic surgeon.
But you know what? That is so important for anybody in the beauty space or even in the hair space. Like if you're sensing red flags, you put your needle on that lady. Now you're the one that put the cadaver in her lips.
It's true.
You're
If
like,
something goes wrong,
Right?
now it's you. So
Yeah.
that's why you've got to like know exactly what you're working with, exactly what
Right.
you're walking into.
well, let's touch base on that for a minute because I think it's so important to know your brand and your boundaries. Have you had to figure that out? Do you have your own practice or do you work with somebody?
I don't. I work with someone else.
Okay.
I love the group that I've been with for like the past 5.5 years now. They're
Oh, okay.
amazing. We've got like such a little family there. But you really do figure out your style over time.
Yeah.
And so I've kind of created, my business within that,
Right.
over time. The assistants know exactly
Right.
what I'm working with, what I'm willing to do, what I'm not willing to do. The second they hear
Right.
silicone, I'm out.
They know you're not going to touch it.
Yeah, exactly. So they're able to kind of tell like if someone's a good candidate or not. It's just they learn so much working with you, and you
Right.
learn so much about yourself over time
Well,
too, to where what you're comfortable with. What are your boundaries?
Will you take on like a problem case or are you just like, no?
I do.
I was like, right. Here's my rule of thumb. Cause even in hair, there's some that are like the problem case and you're like, I'm not going to put my name on that. And then there's some you're like, I genuinely think I can be realistic with expectations and I can help you.
Yeah.
You're like, is it going to be perfect? No, but I can get you, I can make it look a little bit better. Have you had clients like that where you kind of,
Oh yeah.
like little fixes here and there?
So I am known to be a lip rehabilitator.
Okay.
So I do a lot of dissolving and refilling
Hmm.
of bad lip jobs, but I've also taken on not problem clients, but situations where they've had something called like a vascular occlusion. So at a different practice, some filler was injected in or near an artery or a vein, and there's a problem and they don't know how to fix it. And they can't get back into that injector, or
Yeah.
I'm more convenient.
What happens? Like when,
So that's the scariest thing that can
Okay.
happen with filler. And that's, that blood is cut off to that
Oh, yeah,
area,
yeah.
or there's minimized amount of blood that's able to flow to that
Yeah,
area.
that's
So you need to
scary.
dissolve, which is why you want a dissolvable filler.
Yeah.
So I've taken on those cases. We have an ultrasound in our office to where we can really hone in on exactly where the problem is and
Yeah.
help it. But
what
the
are some,
complications are interesting for sure.
what are some of the biggest risks?
that is
That,
definitely
right?
the
And
one
how do
that
you
you don't want to
how do you
happen.
avoid that?
So it's really important to know your anatomy. And it's another reason why you've got to constantly be brushing up on your education. Knowing your anatomy, knowing exactly what to do and what your protocol is in case it happens. It's just important to be aware of what the potential risks are and how to help your patient or anyone else's patient.
Is it when you look at somebody's face? It's what's interesting is I'm like, could you inject on somebody some spot and then you couldn't do it on somebody the same spot? You know what I mean? Like I had one time I was getting Botox done and I hit like a nerve ending. And it like almost shot in the back of my head. It looked fine, but it was so annoying. And my injector at the time was like, oh my God, that's super uncommon. I'm so sorry that happened. So I'm like, that's so weird how like little things, it's risky, but I'm also like, but my forehead looks just frozen. So I don't know.
You're like, I look great, so I'm fine. Listen, everyone's anatomy is similar but different.
Right.
So there's different variations of where certain arteries run, but usually we all have the same arteries. You know what I'm saying? Like we're all a little bit different.
Right.
So things can happen, but that's why you've got to know, even if you're the safest injector and you know your anatomy perfectly.
Sometimes there's risks that happen.
Exactly. And that goes back to that experience level,
Right.
going back to an injector who makes sure they have a good amount of experience, because we've all had a complication before, and that's important to know exactly what to do if you're treating your own complication or someone else's. We should be able to help each other out.
Right.
Like I had a girl from Texas who had a complication and she was in Florida.
Yeah.
What's she going to do? Fly back to Texas?
Yeah. So then you should find
Exactly. She wasn't my
client.
client. She found me. She asked if I would help. Sure. Why not?
Yeah. I got a lip question. So with all my fillers, I had one, as we were dissolving, I had one little spot. It wouldn't dissolve. What is that?
So annoying.
It wouldn't go away. We just finally just evened it out on the other side because it was like a little ball. Like, what is it? Scar tissue? Like,
so it could be scar tissue. Okay. It could be filler that was just trapped there.
We went after it.
You're
and
like,
I finally was just like, leave it alone, but I was like, I didn't know what it was. Is that common?
I wouldn't say it's common, but it can definitely happen. Yeah. And then you just try to camouflage.
That's
so I tell people that all the time.
Yeah.
And sometimes you have to deal with like scars, dog bites and lips, super common.
Wow.
Or I trip and fall and my tooth went through my lip or something. You hear those things.
And then you can hide it with a little bit of filler.
All the time. You just try to hide it and camouflage the best you can.
Yeah, that's crazy. So tell people that wanted to come like find out more information on your trainings. Obviously they have to be in your field, but how could they find out more information about any of your classes or things you have coming up?
Yeah, so you can always go to my Instagram page and just DM me, and I'm happy to answer any questions on there, and then tell you about what my next openings are. I book out a few months in advance typically.
Are they mostly private trainings right now?
It's a good mix of both, private and pharmaceutical trainings, but they're great. And sometimes they're bigger events too. I fly across the country and do like 30-person trainings.
Oh, cool.
They're fun.
Do you have a bigger one coming up soon?
I just finished Austin and I head to Michigan on Friday.
Oh, awesome.
So,
do you take time off when you have children?
My children, my son is very important. Yeah. Daughter will be too. But I try to make sure I'm getting that work-life balance. Yeah. So my weekends are important.
Yeah, I'm sure it's like one of those things when you're in anything in the beauty space and you're having a baby, your clients are immediately like, I love you, but when are you going to be back?
Oh yeah. Maternity leave is very stressful for everyone in the office and my clientele. They're like, oh God, when's your next day back?
Yeah. Do you take a little time off and refer them to somebody else so you can have a little extra time off?
Yeah. So there's 5 injectors in my practice. Oh, okay. So we've got plenty of coverage in case anyone needs.
I was like, people are going to listen to this podcast and they're going to seek you out, and all of a sudden you're going to be like, sorry, I'm going on maternity leave.
Well, I'm 21 weeks, so we've got a little bit of time.
We got time.
But yeah, I try to get everyone in before. Like, thankfully, I'm due just before the holidays. So all my patients are like, great, we'll get holiday ready. We'll be good to go.
Yeah.
We'll get our talks just in time.
Right.
So as long as she doesn't want to make her entrance into the world a little early, we'll be good to go.
That's funny. Tell everyone where you're located at.
So I'm at Peace Love Med Spa in Boca Raton. That's where I inject, and then I travel to your practice to train.
Oh, cool.
I keep it really convenient.
Yeah, that works out good.
Yeah, so everyone's comfy in their practice.
I was like, okay, so is there any other juicy secrets that we need to talk about? I feel like we covered a lot of it. We talked about the asses. We talked about Lindsay Lohan's face. We talked about Kris Jenner. I mean, those are the most important things.
The most important things in the world. God knows we're all talking about it all the time. But just keep up with your skincare and your talks, definitely.
And go to somebody, like I said, who's got experience and aligns with what look you're looking for.
Exactly.
So if you want to look natural and rejuvenated, then
look for the injector that does that. Another good indicator is to look at your injector.
Oh, I agree. I was like looking at your skin. I'm like, yeah, you got great skin.
Well, don't look at my lips. I'm swollen from this pregnancy.
It's the pregnancy glow.
But you've got to look at your injector and see, like, do I like their appearance? Because your injector is going to obviously like carry themselves a certain way.
Yeah. We
want to make sure we look our best. And if that's what we think our best looks like, then make sure you align with that.
Yeah, I agree with that. Same in like the hair industry. I'm like, never go to a girl if you don't like her hair, or if she doesn't do her hair ever,
For sure.
So you got to keep on it.
Oh, that's definitely an interesting one too. The injectors who have never had anything injected in their face.
Yeah, right.
I'm like,
You're like, but why do you?
You should know from personal experience how that feels.
Totally.
Not to say that you need a ton done or anything, but just a little something.
Yeah,
just can talk from experience.
Exactly. Even it's so funny because I train men on hair extensions, so I was like, if your hair's long enough, put a row in so you can experience it and talk to your clients about it. But
it's good to be able to talk about like what it feels like.
It's good. I know.
And
then it makes you more, trustworthy.
Yeah.
Because you're like, well, here's what I believe experienced. Yeah, this is what I like. This is what I didn't like. Well, tell them where they can find you on Instagram.
Oh, the aesthetic specialist.
Okay.
So THEAES, I usually pop right up.
All right. Well, if you guys want to check out Lindsey Harders and you check her out on Instagram, you can DM her. You can ask her questions. Anything you want to know, she'll probably do a consultation if they're in the area, right?
Of course. People fly in all the time too. Yeah. So you can DM me for pictures in case you want to do that before your flight. And then obviously just come on in whenever you're ready.
Do you do like FaceTime consultations if they wanted?
Typically a little busy for that, but send pictures from the front and both sides and I'll do a little consultation for you so you know exactly what to expect before you make your trip down here.
Amazing. Well, thank you for being on the show and educating us people who think that everything is Botox and we don't know what fillers we're putting in our face.
Listen, it's not your job to know everything.
It's good to know it's not our job, then we need to go to experts that it is their job. So you guys, that is it for the beauty series here with Lindsey. Share this with some of your friends if they're considering any kind of fillers or Botox, or what to look for, what to not look for. Share this with your friends, and we'll see you guys on another episode of the Danielle K White Show.